I'm an internal medicine specialist and a rheumatologist trained in Romania. In the beginning of my career, I was invited to one of the first EULAR courses, which was the first EULAR postgraduate course in Marsilia. This was many years ago, but it was for me a very important moment, and it was also eye-opening. Since then, I was doing two jobs, so I was a physician and a teacher. But most of all, I was a teacher the majority of my career. And so having this opportunity to be the chair of education, it seems that someone was seeing my big interest in teaching. So, of course, it's a great challenge, but we will be able to make many good things together. I have two reasons for entering rheumatology. When I was in school, I wanted to become an archaeologist. And this was not because I liked history, but also because I like to see signs, to find traces, and to put together all this in inventing a story. And I think rheumatology is like this, because we need to look after signs, we need to listen carefully to our patients and to refine and to find their diagnosis and stories. And the second reason is when I was in the medical schools in the third year, when I was to the clinical examination, to the semiology, one of my first day in the hospital, I met a patient. He was a mid-aged man. His name was Petru, and he had a severe Behçet disease. And he impressed me a lot, and I was following him for years. And this is my relation with many of my patients. It's a lifelong relation. We grew up together, we made family together, now we are getting old together. But this relation with our chronic patients, it's important. Committee is one of the most important committees in EULAR because EULAR is a big provider of education. So there are many things which are happening in the field of education in EULAR. There are courses, live courses and online courses. They have different target audience. So there are courses for rheumatologists, for young rheumatologists, for patients, for health professionals. They have also different subjects like rheumatic disease in general, or some specific diseases, or ultrasound courses or capillaroscopy courses. And there are also many other things which are happening in the field of education, like bursaries, short-term bursaries, long-term bursaries, exchange programs. So there are also free access materials like webinars, which are regular, and you can see them whenever you want. I'm always telling my students that rheumatology is the most beautiful specialties between the medical specialties. It's an evolving specialty, it's changing a lot. In the last years, rheumatology was changed a lot. We have many things about understanding etiopathogenesis. We also have many drugs which are really very effective. So it's really a good time to be a rheumatologist. Very good thing about this specialty is that it remains a clinical one. So history taking, clinical examination, looking for signs, it's important. And this makes us very close to patient, and this is a nice thing. Also, rheumatologists are in the last years in all the medical polls are the happiest specialty, so we are happy, and there are many reasons for this. And of course, for this, rheumatology has to be present in the curricula of all the medical universities in the world. This is an important task, and EULAR can help also for this. I'm the only teacher singing in the university choir, which is healthier than drinking and cheaper than therapy. I'm a good gardener, and flowers are blossom near my hands. And I'm a bad cook, and all my family is smiling when I'm approaching the kitchen.